resources that are available to businesses and business owners as they try to survive this devastating impact that we're seeing as a result of the coronavirus. Today, we're going to hear about one resource right here in San Diego that's available to people who are struggling to find work and to make ends meet. For many years, I've been fortunate to serve on the San Diego Workforce Partnership. It is an organization that helps people adapt to our rapidly changing skills-based economy. This year, I'm proud to serve as chair of the Partnership's Policy Committee, where I serve alongside Supervisor Nathan Fletcher. Together, we have seen the good work of the partnership that it does with its career centers and its job search, skills development, and training resources. Today, we're going to hear from Peter Kallstrom. He's the CEO of the San Diego Workforce Partnership, and he's going to talk to us about their COVID-19 response to help workers survive this difficult, uncertain time. In addition, we'll get an update from Supervisor Fletcher on our informational charts and graphs, and we'll get a medical update from both Dr. Eric McDonald and Dr. Wilma Wooten. With that, we'll go ahead and get started with Supervisor Fletcher.
Thank you, and good afternoon. There's no doubt we live in unprecedented times, and we've taken unprecedented actions to deal with the challenge in front of us. In San Diego, we have been generally successful in flattening the curve because we took early action and bold action, but also because the actions we took were based on data, on science, on the advice of public health officials. Our actions were guided on what we believed was the best interest of the people of San Diego based on the evidence presented before us and the case studies that we could look and the lessons we could learn from other places. To come out of this successfully, we have to take that same approach. Actions guided by science, by data, by public health, not actions guided by politics. And it is an important reminder every single step of the way that the decisions that we're making will have implications and impacts far beyond just those of public health, and we do take into account the totality of the circumstance and situations we face and are very mindful of the impacts of the actions we take. Although we have a daily effort focused around protecting life and promoting health, we are mindful that each and every action we take has other impacts and other actions, and we try to strike the right balance in everything that we do. In this spirit of finding the right balance for the state of California and charting the pathway forward, Governor Gavin Newsom today laid out a framework that will guide the decision-making for the state of California as we move into the future, and as we move into potential future phases, which might include in the future the scaling back of non-pharmacological interventions and opening communities back up. It is important to note, and I'll reiterate, the governor was clear that none of these actions should be expected or anticipated in the immediate future. When asked specifically when these things may happen, his answer was, ask me at the end of April, which again reiterates our call of April to be a month of action, a month of progress, a month of sustained commitment that will give us the most solid foundation to begin the recovery process at the appropriate time, with an understanding that the worst thing we could do would be to prematurely move and undo the progress that's been made and undo the lives that have been saved and be in a position where we're having to reimpose actions and efforts. And so we're very mindful as we move forward of doing it in a thoughtful and methodical way and in a way that really is guided by what we believe is most sustainable. Today, the governor outlined the approach and he made a specific point in his announcement to mention the critical role that county governments and public health departments will play in preparing for these future efforts. Our county government is prepared to do our part in addressing this region's obligation to set the stage for the future action. But again, to reiterate, any ability to move forward into a new phase is predicated on our ability to sustain the commitment that we have now in order to give us a solid foundation to launch from and a solid area to begin to focus on what the future might look like. I want to walk through the 6 areas that the governor outlined and share with you how these align very much with our ongoing efforts at the county. The first is the governor said we must have the ability to monitor and protect our communities through testing, contact tracing, isolation, quarantine, and supporting those who are positive or exposed. This is a large part of the focus and effort around the increase in the availability of testing to get to a place where we have the ability to rapidly test individuals, particularly individuals who present symptoms, the ability to trace anyone else they may have been in contact, test those individuals, isolate or quarantine anyone who has a positive test. That capacity is going to be foundational to the ability to move forward. Second, he talked about the ability to present infected persons who are most at risk or who face the greatest challenge or risk from COVID-19. In particular, these are efforts around our seniors, our congregate care settings, nursing homes, and the homeless, a series of efforts that we have been underway on since well before the onset of our first case, and something we are mindful will definitely need to continue into the next phases. The third the governor outlined was the ability of hospital and health systems to be able to handle surges. This is in large part an effort we've talked about multiple times about raising the bar, increasing the capacity of our healthcare system to be able to respond to the specific challenges presented to us by coronavirus. And we will continue to monitor that capacity, to increase that capacity, to have the available personal protective equipment, the ventilators, all of the components that go into that to prepare our region to move forward. Fourth was the ability to develop and monitor the research and latest science around therapeutics, vaccines, the ongoing research that happens in San Diego. We should be proud that some of the groundbreaking research from around the world is taking place at our institutions here, and we will continue to partner and work with them. The fifth area the governor outlined was the ability for businesses, schools, and child care facilities to operate in a new era, to ensure not only physical distancing, but to ensure hygiene standards, to really reimagine. They talked about redrawing the floor plan, and these are efforts that we will engage our various sectors on to continue to think about what that may look like, along with further guidance from the state of California about how those entities might be able to reopen. And the sixth was the ability to determine when to reinstate certain measures, such as the stay-at-home orders if necessary. This was really the ability to monitor the progress when you move into another phase of beginning to reopen, and knowing when is appropriate to take a step forward, and unfortunately outlining and recognizing when you may be required to take a step back. For each of these 6 areas at the county, we have been working on each and every one of these, and in the coming days and weeks, we will continue to sharpen our focus and increase our commitment to ensure that our region is prepared to answer these questions, to prepare for these areas of focus, and to be aligned with the state of California as we begin to move forward. But again, to reiterate, the ability to see progress in any of these areas in terms of reopening our economy and reopening our society is really predicated on our ability to have continued progress, to have continued sustained flattening of the curve, to have continued commitment from the public in terms of really adhering to the message. On April 1st, we came out and tried to make April a focus. We talked about it being a critical month, and the people of San Diego have responded, and it has been difficult, but we want to encourage you to continue along the path that we've been going on, because it is laying the foundation for us to begin to think about, to contemplate, to prepare the next steps. I also want to reiterate something the governor said is everyone out there will want to know what date will what happen, and the reality is we don't know. The reality is we have to continue to assess our progress. We have some work to do in these 6 areas in building up our capacity, building up our infrastructure, building up our ability to comply with each of those, and then we will move at the guidance and direction of our public health experts in close coordination with the state of California, and being ever mindful that the reality is our way of life will be different for a while. We will come back. We will get through this. We will make progress. We will rebuild. But it is really important that we do it in the right way, and that we do it in the proper way. And that's not only important for the life and health of our residents, it is important for the life and health of our economy to have a sustained rebuild and a sustained pathway out of this. So we will continue our coordination with the state of California along with our internal efforts in these 6 core key areas. Before we get to today's charts, I want to give a brief update on something that is new. This is a great testament to our philanthropic community, to our partnerships across multiple sectors. There's certainly been a focus around issues of the homeless, a focus around issues of the convention center. The Lucky Duck Foundation has stepped up to secure additional capacity for testing that was not previously available. They are privately paying for this testing capacity, and in partnership with family health centers, they will begin COVID-19 testing for all unsheltered individuals who are currently in the convention center. The testing will start on Thursday with 150 tests a day, They will ramp up to 250 tests a day until they have tested everyone who is in the convention center. And I want to personally thank Dan Shea, Peter Seidler, Pat and Stephanie Kilkenny for putting up the resources, but also expending the effort to go secure this additional testing capacity and putting it to use in a coordinated way, not only with the County of San Diego's Department of Public Health, but with the City of San Diego and the Regional Task Force on Homeless, and everyone who is involved in trying to protect this vulnerable population in the convention center. And so to the Lucky Duck Foundation, we appreciate their commitment and their continued efforts around issues of homeless, and we look forward to continuing to work with them. With that, we will jump into our charts and give you our daily update on numbers, and then we'll hear from Peter Kallstrom, the CEO of the San Diego Workforce Partnership. Today, we are reporting 83 new positive cases. This brings us to a total of 1,930. And again, to reiterate the points that have been made day in and day out throughout this evolution, the day-to-day numbers are not significantly important. It is broader trends that we are looking for and trying to see. In terms of testing, we're reporting 919 tests that were reported to us yesterday. That puts us over the threshold of 27,000, 27,048 total tests that have done in the County of San Diego that have been reported to us. That tracks right along when you look at total tests versus total positives. On the next chart, you can see we continue to hold steady there. About 93% of the tests come back negative, about 7% are positive. Our comparison of positives, estimated recoveries, hospitalizations, ICUs, and the unfortunate loss of life is presented to you on this chart. Again, recoveries are an estimated recovery, which is a statistical sampling of 14 days post-positive test adjusted for the loss of life. You can expect that this slope and curve will mirror reasonably closely in scale to the positive test. Hospitalizations at 450, that is up 30 from yesterday. ICUs is +8. ICUs is a subset of the hospitalization total, and the loss of life is an increase of 6 from yesterday. In our hotel rooms, public health rooms, slight uptick in occupied, slight downtick in number of guests. Those rooms continue to be utilized for individuals who have tested positive, who are a person under investigation or unique circumstances, individuals with symptoms awaiting further evaluation, and we will continue to make those available for that purpose as we move forward. Regional Task Force on Homeless, modest jump both in occupied and guest, as those rooms play a piece of the broader effort around homelessness and housing those that are most vulnerable. Outreach efforts, our 211 calls have now topped 70,000 calls. Continues to be a great resource. Increase in nurse triage line calls, epi calls. Hygiene kits and toilets distributed remain static. Hand washing stations is down a few, just readjusting locations where they are most appropriate. Personal protective equipment, we saw an increase in every single category from our report yesterday, and we have now surpassed 2 million individual items of personal protective equipment that have been distributed. And these only include the broadest categories of things that we are most focused on. There are a number of other personal protective equipment and hygiene items that we routinely distribute to our health system and other partners that are not represented here, but this does represent the core of our focus, and we are now over 2 million individual items. You'll see an increase in the number of ventilators. We have all 23 of our 23 area hospitals reporting 589 available ventilators in San Diego County. This is not the total system availability. It is what is available. It is not the total number that our hospitals have. This is a total number that our hospitals presently have available for use, along with the 93 in county stockpile ready to deploy when needed, along with those being serviced, those we've requested from the state, and those that we've ordered. That concludes my update, and now I'd like to introduce Peter Kallstrom, the CEO of the San Diego Workforce Partnership, for an update on some of the programs and efforts that they have available to help our San Diego workers. Thank you.
Thank you, Supervisor Fletcher and Supervisor Cox. And as mentioned, both serve on our policy board, and they help guide our work every single day before this crisis and throughout. So we really appreciate your leadership and really appreciate the very proactive and aggressive work that's gone into controlling this terrible outbreak. At the Workforce Partnership, we've been around for 45 years, serving the entire county. So we serve both all job seekers throughout the region, tens of thousands, and employers throughout the region. And we're a matchmaker. We put folks to work. We work with every person on what they want to do in their career, and we work with employers to help source talent so that we can reach their needs. So in normal circumstances, we have large career centers throughout the region where people go in person to get a variety of supports. We've been able to pivot that to online, and we're doing the same work remotely and virtually that we were doing in person. So most importantly, all of these services are available on our website, which is workforce.org, a very simple URL to remember, workforce.org. We have both individual pages for the workers and how they've been affected, as well as the employers and resources for them, as well as, very importantly, a career portal. So right now, I just checked it before coming here today, and we have over 300 open jobs right now. These are everywhere from Qualcomm to Home Depot to Scripps. They're all over the place, and it's a very dynamic time, so we really encourage people to sign up, go there, and avail themselves of these resources. There's many jobs. This is going to be a very tumultuous time until things get back to the normalcy that we expect and will get to, but it's just going to take time, and to heed the advice of the supervisors that the month of April is just so crucial, and we just need to follow these very important health guidelines. And when we do that, our economy is going to come back. And when we come back and as we go through this process, the Workforce Partnership is there for the entire region. So workers, go there. We're able to help you connect for unemployment insurance. And as some may have seen, the governor and Secretary Julie Su of the California Workforce and Development Agency put in place more workers who are going to be able to process UI claims even quicker, because we know that's been a deluge and it's been very hard for people to access their benefits. But they've really ramped up. They have more people, so we really encourage you to go right to the EDD site or just go through us, and the worker page will provide that resource as well. For employers, many have to go through what's called a WARN, a Worker Adjustment Retraining Notice, and let us know so that we can reach out to you and provide supports to your workers, your impacted, laid-off workers, and to the employers themselves. So go there. We're here for you, and we report that information and keep track. And then we're there as we come out of this, because we will. As the supervisors have noted, this is a temporary time. It's very painful. It's quite frightening for many, but we're going to come out of this. And we're going to be there for the region through this and beyond. Go to workforce.org. There's a lot of resources. We're updating it continuously. And again, to reiterate, 300 open jobs right now, many more to come as this economy shifts and changes through this whole process. But we're here for you. And I also want to just thank the supervisors in the county for the Community Response Fund in partnership with the San Diego Foundation and the United Way. For those who have some resources to give, I can't think of a better resource to be able to provide those dollars that get to workers who are impacted right now. So please go check that out at the San Diego Foundation's site or to the county's site as well. So thank you for all you're doing through this very interesting and scary time, but we're going to get better. We're going to come out of this and follow the advice of the supervisors in the county. Thank you.
Thank you for that briefing on the Workforce Partnership. It was really important and yeah, I think exciting to hear about some of those opportunities, so thank you. I'd like to give a brief update on the statistics. The information from the Johns Hopkins dashboard from about 12:30 today, I think is going to be on your screen in a moment. Yes. These are actually cumulative numbers. It says daily, but we give the report every day, but I just want people to be sure that these are not daily numbers. These are cumulative numbers since the outbreak began. For the global situation, just under 2 million cases have been reported worldwide, and just under 125,000 cases have died. Nationally, we're just under 600,000 cases with over 25,000 deaths. In the state of California, there are 2,438 cases that have been reported with 732 deaths, and these numbers are a little different than what the governor briefed, because these again are coming from the Johns Hopkins website. And as we've heard today, we now have 1,930 cases in San Diego. That's an increase of 83, and 53 deaths in San Diego, and that's an increase of 6. The three individuals who died were three of the men were 63, 79, and 86 years old, and the women were 81, 98, and 100 years old. The next slide, I believe, shows the information in a little bit more detail about our cases. The age range goes from 3 months to 100 years of age. 998, or 52%, are between the ages of 20 and 49. 971, or 50%, are male, and 450 have been hospitalized. 164 have been in the intensive care unit, and that represents about a third of all people who have been hospitalized. Lastly, on the deaths, the 53 deaths represent 2.7% of the total number of cases, which is a little higher than maybe reported in other jurisdictions. It may be a measure of the cases that are in the community that we're not counting and not being able to detect through testing. All but 2 of these cases had underlying medical conditions. Next slide. Again, on the deaths, of them, 55% were male, 44% were female. There's no real change in the demographics of the race and ethnicity, which are on the slide. And I do want to express my sincere condolences to everyone who's been affected by this disease, including the deaths and the severe illnesses that have resulted. You know, I also want to thank everybody for the sacrifices that they've made to keep these numbers where they are. If I can tell a brief story, when I was in medical school, I learned about the 1918 epidemic, and I was fortunate enough to have access to my grandmother, who was born in 1900 and was alive in the 1980s. And she lived through World War I. She lived through the pandemic in 1918. She lived through the Depression and World War II. And I remember asking her about what it was like to be a teenager at that time. And she said, well, you know, we all knew people who were in the Army. Actually, most people didn't have to go overseas at the time that many people were going into the Army. She grew up in a small town outside of Arkadelphia, Arkansas. And she said, nobody knew anybody who died in the war. But everybody knew someone who died in the epidemic. And that always struck with me. And I think if we think about what we're doing now to keep the curve down and to sacrifice the way we have, it's so that, frankly, our kids aren't going to be telling that kind of story to their grandkids at a future date. So a couple other updates. For the outbreaks we've had so far, there have been 20 in congregate living facilities, representing 182 cases and 22 deaths. 11 outbreaks in community settings, representing 43 cases and 1 death. And I think we do have one more slide, which I do want to show, because we've gotten some questions from some reporters about people who are in the hospital today. And the state is actually collecting information from all the non-federal hospitals and compiling it on their website. You can click on this website. We will also have a link in our news story today so that you can go to this website. You can see actually how many people are in fact hospitalized in our non-federal hospitals on a day-to-day basis. And this gives you a different view than our cumulative numbers on what the effect of the outbreak is. And I think I'll turn it over now to Dr. Wooten, who will do an update on the public health champions for today.
Thank you, Dr. McDonald. Today, I am very excited to announce the Aging and Independent Services 2020 Live Well San Diego 18th Annual Public Health Champion Award. This year's Aging and Independent Services recipient is the San Diego Oasis, an organization that enhances the health of adults 50 years of age and older in our region by providing lifelong learning, physical activity, volunteer service, and social engagement opportunities. San Diego Oasis has over 5,200 active members who participate in classes and activities at 50 sites across the county. The organization is changing the face of aging by empowering older adults to live meaningful and active lives no matter their age. For these efforts, I am very pleased to announce San Diego ACES as the Aging and Independent Services 2020 Live Well San Diego 19th Annual Public Health Champion Award recipient. Over the next 2 days, I will announce the remaining recipients, and thank you for your attention.
We'll go right to the questions. Again, we have 3 calls waiting. If we don't identify by name and by outlet, please do so as you're introduced. Let's go to the first question.
KUSI, please state your name and question.
Hi, this is Hunter Sowers, and I just had a question for Supervisor Fletcher. For residents listening, if he could kind of give us locally what it would look like for us to begin easing those restrictions. What is that going to look like? Is it going to mean more people are going to be asked to commute or telecommute for work? If we could just get more specifics on what that plan entails.
Yeah, I think what we outlined was sharing the governor's kind of 6 criteria or 6 core areas that need to be substantively addressed before there can be any forward momentum or progress around shaping what that would look like. A key part of that was engaging with sectors like businesses and schools to engage in a reimagining or a redesign of what that may look like while we go through the duration of this. And so there aren't any specifics at this point, and when the governor was specifically asked, he said, ask me again at the end of April when we have better insight into what these look like. And so I think what was really framed up for the state of California was the questions that need to be answered, the plans that need to be prepared, the capacity that needs to be built so that we're in a position to begin coming out of this. But again, it is our ability to come out of it is in large part predicated or directed on our ability to see a sustained period of time with sustained progress. And we're just not at that point today. And so our message as a public really is, while conversations are happening, while plans are being developed, while capacity is being built, knowing that at some point we will, of course, come out of this, the single most important thing that we can do today is focus on what's in front of us, which is continuing to bend that curve and continuing to flatten that curve so that when we do begin to come out of it, we're coming out of from a position of strength. And then we just have to all hold patient and know that we're going to all go through this together, and we're going to, in some part, figure out a lot of what the next steps look like in the coming weeks and months.
Thank you. And I just had a follow-up for Dr. McDonald or Dr. Wooten. We see the progress in place right now for the homeless to be tested in the convention center, and I'm just wondering if there are any efforts being made like that for the general public, for those showing symptoms or for those who maybe are most at risk in terms of not maybe needing hospitalization but still needing a test.
Well, I think there's a lot of work going on across the county to increase testing for everyone. Obviously, we're concentrating now when there's limited testing on very specific populations, but the CDC guidance, which we all aspire to be at a state at, is that everyone who has symptoms will have access to a rapid, affordable, and actionable test. So every day things get better. We do know that with increasing capacity specifically in our hospital systems, they are looking at where within their system they can expand that testing. Each system has different priority populations because of who they work with on a regular basis, and they are in fact directing those resources to expand testing every day.
Thank you.
Okay, let's go to the next question.
NBC 7, please state your name and question.
Hi there, this is Priya Sridhar from NBC 7. You guys mentioned that there are 300 jobs available right now, but I know that about 2.3 million Californians filed for unemployment benefits in the last month. Is it really realistic for a lot of people to be job searching right now when we still have the stay-at-home order going on?
I'll let Peter Kalster answer that question.
Yes, it is realistic because there are still essential services and employers who need workers. So yes, there is the stay-at-home order, but there's a lot of sectors, healthcare, and there's great companies like Home Depot who are still in operation and still need staffing, and grocery stores and a number of others that we see as when we do get out in the communities. So hiring is still there. This is a unique time. As I mentioned, over 300 jobs, and that's in flux every single day. And jobs, white-collar jobs, Qualcomm as well, like I mentioned. So there are many jobs out there. This will be a very dynamic and changing period as we come out of this after April and after following the guidance of our elected leaders. And more jobs will come, but what's most important right now is we want people to go there because there are jobs available for those who are looking. Not everyone will be, but they are there, and this will be changing. And we're going to be that resource beyond this period as well. So workforce.org, we are here for you.
Okay, our last call-in question.
Voice of San Diego, please state your name and question.
Hi, this is Will Huntsberry. Thanks for taking my question. So, as you guys have mentioned today, and the governor said too, testing capacity is really important to reopening California and San Diego. We need to know, who can transmit this virus and who is not transmitting it. And you guys have mentioned that testing capacity is going up, and I've heard that a lot, but the strange thing about the numbers is that there were less tests done in the past 7 days than the week before that, and even the week before that as well. So we had about 6,700 tests last week, and more than that in the previous 2 periods. So why aren't we seeing these numbers line up with this assertion that there's more testing capacity? Are there still major reagent hurdles, or what is going on there?
Okay, Dr. McDonald's going to answer that question.
Sure. I think there are always a lot of questions about testing. Remember that what we report are tests that are resulted to us. That's what we report day to day. And there are sometimes substantial time lags between the time the test was performed and the time the test was reported to us. It can be as short as 8 hours if it's done in our public health lab because we get the result right away. It can still be 10 to 12 days from some commercial labs. Really the way that we're going to have universal, rapid, timely testing is when the commercial laboratories, which do the bulk of all lab testing in this country anyway, have that capacity or have positioned the machines for point-of-care testing at individual caregivers' offices and locations to be able to do this sort of thing. So it is kind of hard to look at the numbers and kind of follow a capacity versus reports. Those are 2 different things, and I think that may be getting at why it looks confusing as to why one day there's 2,000 reports and the next day there's only 800. It really is, it's results that are coming in, which is what we have the strongest visibility on, other than what our hospital care partners in the community are communicating with us on a daily basis.
Okay, Dr. McDonald, I have several
So, Dr.
questions.
McDonald,
Go ahead. Sure.
what?
I'm listening. Go ahead.
Thanks. Okay, great. So what is the county's visibility over, how much are we seeing in terms of reported tests? Are we knowing how many commercial tests are being done?
Well, we know what the national capacity is, and since we only get a couple hundred at the most from the thousands that are available in the national capacity, we really don't know what the backlog is. And unfortunately, some of these companies that are providing some of these tests at sites, even in the county, don't always tell us what they're doing and what their negative results are. And so we often only get positive results. So even though they are supposed to do that reporting, we can only get what we get, and we don't know what we don't know. So we understand that at the national level that there's a lot of work being done, but again, the number of tests that we get back from the commercial laboratories really has been fairly constant in the last week to 10 days.
And is our capacity still at like 1,200 tests a day, or how high would you say our capacity is right now? Because we're not averaging 1,200 tests a day being reported in these official numbers.
No, I think that there is some capacity that needs to be used within San Diego, and the question is, what are the specific parts of the community that we need to do extra testing? Remember, though, that capacity is not just the amount of kits that are available or the machines. You alluded earlier to the fact that there still are reagent issues. You have to have the right reagent for the right machine, so even though this one might be working, that one's not, so your overall capacity is down. Plus, you have to have trained staff to actually do the extractions and prepare the machines correctly. And you have to have caregivers who are wearing proper PPE to be able to gather the specimens. And right now, you know, there is an issue with making sure that there's enough PPE to go around for all needs. And it's most important to have that PPE going to individuals who are caring for patients. As more PPE becomes available, I think there'll be more available to actually do the actual testing. So there's a lot of components here. It's not just one number in terms of the capacity of the specific machines.
How many tests would you like to see a day, you know, to help aggressively kind of bring us out of this social distancing situation? How many do you think we would need in this area?
I think it depends on what the outbreak is doing down the road, and I think it's going to be in the order of easily tens of thousands, and that's more than we have now.
All right, thank you. Dr. McDonald, we have a question, actually several, from Terry Figueroa from the Union Tribune, talking about home deaths. How are those being tracked, and what about the deaths of people who had not previously been diagnosed?
Well, anybody who dies at home needs to have an investigation done, and that's something that our medical examiner does on a routine basis. In this unfortunate time of COVID, we think about that as potentially one of the causes of death, and so with our medical examiner, if it's a specific medical examiner case, or if it was somebody who was found in extremis and brought to the hospital and died quickly, there are arrangements made to do testing on those individuals to determine if they could have been due to COVID. But we haven't had too many of those cases, fortunately. I think it was reported that one of our residents in Riverside actually was one of those cases that was found at home and needed to be investigated in this manner, which took a while to be sure that it was assigned to COVID. Those cases do take a little bit of time to investigate. Really, there are many things that can cause death at home, and this is just one of them, unfortunately.
And related, how do you ensure they get counted? Who decides which of those deaths is tested as possible COVID-19 and how many may be missed?
Well, those are individual decisions made by the circumstances of the death. Again, some of the tests are dedicated for this purpose to be able to properly understand what has caused a fatality. I think that, again, that's if you to go into the great details, perhaps that would be a good set of questions for a medical examiner, and they could follow up with you at a later time. And is there a second part to that question too, or I might have missed that piece?
I'm sorry, I was already looking ahead.
Sorry.
Just referencing how they might be missed if those tests are done and some are not done.
Well, again, that's a great question about missed deaths due to COVID. I mean, I think we're still learning a lot about this disease. It turns out that it doesn't just cause lung illness. It can cause other types of illnesses. There have been case reports of it causing hemorrhagic encephalitis. It can cause inflammation of the heart. It can cause other types of things. We've learned over the years with a disease like influenza that we thought we knew very well, that it increases your risk for heart attacks for up to 2 weeks after you've had influenza. And some of those cases that had been formerly classified as only heart attacks, as if that's something that you should say only about, it in fact was related to influenza. And we may learn that there are other conditions that are exacerbated by or made worse by COVID, and it may at first appear that the death is associated with the underlying condition, but really could be COVID. I think that this issue of potentially missed deaths is one that we are all concerned about with a new disease, and we're trying the best we can to evaluate each of the deaths that is reported in San Diego to be sure that we're correctly assigning it either as COVID-related or not COVID-related.
All right, thank you. And this one is from Jesse from Voice of San Diego. On Friday, you, Dr. McDonald, said that you're not evaluating any proposals from companies to contact trace electronically, as some other U.S. cities and counties and countries are doing. Has that changed, and do you believe the approximately 100 people who are currently working on retracing the steps of sick patients will be adequate over the long term when parts of the economy are allowed to reopen?
Well, I think that was two exciting things we heard from the governor's press conference earlier today, kind of laying out the roadmap forward. One was he specifically addressed public health force capacity and talked about the importance of contact tracing and indicated that there would be support from the state to expand the number of individuals who are doing contact tracing. And so we look forward to working with the state on operationalizing that to be sure that we in fact can bring more people on board, because I think we do need more to do the very extensive contact tracing that is envisioned down the road. And then with respect to the apps, that was also referenced in the governor's press conference today, that the state is looking at various types of options that would help with electronically doing this contact tracing. And I think having a statewide approach to this is very good, because again, when we get to the point where we are moving more freely and in a pre-COVID type of environment, we're going to be going in and out of the county, and it's nice to have an app that is applicable across the state. And so we're looking forward to their leadership and to giving us the best information we can about using those electronic resources.
And also, homeless individuals who test positive for COVID-19 may be harder to trace than other segments of the population, as they may not necessarily know everyone they've come into contact with and may not be easily found. How are your investigators accounting for the unique contact tracing challenges among the homeless population?
That particular population is one that is challenging to do contact tracing, and I'll be honest and tell you that we learned an awful lot from our hepatitis A outbreak, which was primarily and disproportionately affecting the homeless. We made a lot of bonds and established a lot of relationships with organizations and individuals who regularly worked with the homeless population during that outbreak, and we sustained those relationships to be able to continue to do the types of investigations that we need to do to identify their close contacts. So we know the various parts of the county that homeless individuals might be living in, and we know how to sort of track people down when a homeless individual may only know the first name of somebody or just the general location that they came in contact with other people. So we do work with our homeless outreach teams, and again, individuals who are very skilled at speaking with individuals who've lived on the street, sometime for a long time, about the clues that we need to identify those close contacts.
All right. Thank you, Dr. McDonald.
This next question deals with mass gatherings and businesses reopening, and Supervisor Fletcher is going to respond to that question.
Yes, this question is from Claudia with Univision. Do we have a local estimated time for reopening business? The governor mentioned mass gatherings are not recommended until we have a vaccine. Do you think global events such as Comic-Con will be canceled for 2020?
Well, we don't have a date estimation. It is really determined on the progress we make, both in terms of our continued commitment to the actions we've taken, along with the progress we make on addressing those 6 core areas that were outlined. Those will be the 2 things that really guide our ability to begin to come out of this. As it relates to mass gatherings, we really don't have a firm date or estimation. The governor stated he thought it was unlikely in the foreseeable future we would see large mass gatherings of the thousands. It was his opinion that it was unlikely until such time as we either had a really robust treatment mechanism or a vaccine, but we would really not be wise for us to speculate on a date or a number on something upon which we just simply don't know. And so we have to continue to work through each of the steps in front of us and continue to progress and share with you the latest as we have greater clarity into those questions.
Thank you, Supervisor Fletcher.
This next question deals with the border situation, and Dr. Wooten's going to respond to that question.
Yes, and this one is also from Claudia. We received a press release from Scripps about concerns over relaxing restrictions and how this could overwhelm the health system. As a border city, and considering that our neighbors in Baja California are not as successful in flattening the curve, how will the county react to the idea of reopening the border and coming back to business?
Well, first, I'd like to point out the fact that the county does not have the authority to reopen the border. That resides with the federal government. And we continue to work with our partners on the other side of the border and partners that engage the border on this side. So we have national border health entities that we continue to work with. But in terms of opening the border, currently it is closed except for individuals coming back and forth for essential services and individuals who are U.S. citizens. So again, the county does not have the authority to open up or close the border. Thank you.
Thank you, Dr. Wooten.
This last question deals with the testing of homeless individuals, and Dr. McDonald is going to respond to that question.
And this question is from Gary Worth with the UT. Is there an update on how many homeless people have tested positive?
As of 8 o'clock this morning, there are no new individuals who have tested positive who are homeless. We look at this on a 24-hour cycle, and that is one of our key important metrics to follow, but there have been no new ones since our last update.
That concludes our questions for today. I want to thank Peter Kallstrom from the San Diego Workforce Partnership for being with us today and enlightening us in regards to some very, very valuable information on joblessness and jobs that are available. But I also want to end on a positive note, as we try to do every day, and talk about some of the good news we're hearing throughout the region. In Chula Vista, the wellness director at the Silvercrest Senior Living Center organized a food and supply drive for residents living there and got donations of food, money, and paper towels along with other necessities. In San Diego, a 7-year-old boy who couldn't have his birthday party because he was following the order to stay at home got a big surprise when San Diego Police Department officers drove by with their sirens blaring, and they all sang happy birthday to him through their loudspeakers. Small but powerful efforts like this sometimes get lost in the sheer size of magnitude of what we're dealing with in this global pandemic. But they do mean so much, and they show that we're not letting the crisis beat us down or define us. Months from now, when this is all over, we're all going to be able to look back, and I think with a great deal of pride, about the efforts that we all had in coming together to defeat this virus. And finally, let me remind all of you about our campaign to get people to stay in place for someone they love. Excuse me. So thank you, San Diegans, for participating and sending in several examples of the Stay Home campaign that we're showing you right now. We want you to send us a picture of a loved one you've pledged to protect by following a simple request to stay in place, maintain space, and cover your face. Remember to hold up a sign with your loved one's name. To submit your photo or to take the pledge, go to coronavirus-sd.org. This concludes our briefing for today. We'll be back tomorrow at 2:30. And again, remember, stay in place, maintain space, and cover your face. Until 2:30 tomorrow, we'll be back.